welcome back to another episode of For All Stages and Ages. Today I'm joined by Tina Southwood. Tina is a sleep training consultant. Thank you so much for coming on. Do you want to tell everyone a little bit about you and your background?
Yes, of course. I've always had a great love of babies and children from since I was tiny myself. My mum used to be a childminder back in the 70s and 80s, and I was always baby obsessed. So I think that's where my love of babies and children came from, and I always seemed very confident and natural around them. However, I left school and very quickly became a daytime nanny, looking after usually always newborns or toddlers, and absolutely loved it. Then I moved from London to St Neots in 1988 and continued with my career as a daytime professional nanny, which I absolutely loved for 17 years. Worked for one family, both of their babies from birth to age 9 and 7. Knew that I always wanted to continue in the baby industry, but didn't really know quite what I wanted to do. I was in between jobs. I was registered with a few local agencies, and they contacted me out of the blue, and they just said, I've got a family living locally, really struggling with their baby. Are you able to help them? They just want daytimes. The mum was really struggling with postnatal depression, wasn't really bonding with the baby. The baby had a lot of medical issues that hadn't really been properly addressed. They'd stopped giving him the medications. They felt it wasn't working. So I'd been a daytime nanny for babies for 17 years. And then in 2004, I stepped into the kind of more the sleep side of things for babies. I stepped in, started working with this baby who was just about 5 months old. The mum was in a really bad way. Normally she was a professional, had a good job, very confident mum, very business minded, but she'd lost all of her confidence. She really was struggling with her baby, and he was waking up 7-8 times a night, wasn't barely even making 45-minute sleep cycles. I stepped in, did the daytimes, and that was the start of my career as a maternity night nurse and a sleep consultant. So the mum basically, she said to me, Tina, I think you're really wasted as a daytime nanny. You've got this talent that you don't really realise you've got. You should set up your own business. So I thought living in a small town like St Neots is probably not going to work. I was very wrong. Very quickly, she had recommended me to a lot of her friends who part of her NCT group. And within weeks, I was travelling around different villages, seeing different families, just giving them some gentle guidance, some tips and stuff like that for their babies. Most of the babies at that time were all under 8 months of age. And then she said to me, look, I really feel I can help you with setting up a business. So I thought, I'd love to do this. This would be my absolute dream, working with babies and newborns and families and helping them. So in 2005, I set up Sleep Baby Sleep, and it's literally gone from strength to strength. I got myself onto lots of courses. Obviously, I'd already had the 17 years of hands-on experience with babies and toddlers anyway, but I really wanted to focus on the sleep side of things. It was within 2 to 3 weeks of looking after this particular baby, he was sleeping 12 hours a night. And that was basically I always say to all of my clients, I'm not a doctor, I'm not medically trained, but because I've got the experience, I will always signpost or give them the tips and the advice, and then they can see where they go from there. So I had suggested to this particular client that she reinstated the medication that the baby was on at that time that she had stopped. And obviously certain medications do come with side effects, constipation, just various things that it can cause side effects. But obviously, again, with my experience, I knew how to handle those minor details. She'd reinstated the medication. At the same time, it coincided with this baby starting to become weaned on solid food, which obviously did help because this baby had significant reflux issues and was intolerant to certain food groups. We'd got him started onto weaning. That did lead to a few other complications and problems, but we resolved those. And very quickly he was doing up to 12 hours at night. Mum was a new woman. So I continued working for them for, I think it was about 10 months as a daytime nanny, just going to them on a daily basis, trying to build mum's confidence up, and really enjoyed it. And then after that, I set up my own business, Sleep Baby Sleep. Been going around consulting, seeing families on a day-to-day basis. And on top of that, a night maternity nurse for newborns. So that's what I do mostly. Most of my work is at night. I generally do a 10 to 12 hour overnight shift, starting at 9, finishing at 7, flexible with the start time. If I'm going in on a sleep training job, obviously they want me there a lot earlier to sort out the bedtime routine. But that's generally how Sleep Baby Sleep.
Fantastic. That's a lovely story. I probably could have done with someone like you, actually, when my little boy was born. He's 4 now, and he was born literally like the first week of the first lockdown that we had in the UK. So I had none of the CT classes. I had no parenting groups. My last but one scan was cancelled. All of that we had no support at all because of it being COVID. So we were pretty much left to, here's a baby, off you go. That was our kind of journey with it. So I had no support with sleep. And my little boy, very similar to the story that you just told, we struggled really badly with him, especially in the first, I'd say it was probably about the first 4 months, which were really bad, where after he was born, he was very attachment sleeping. We couldn't get him to sleep in a cot. We couldn't get him to sleep in a crib. We couldn't get him to sleep in our bed. Anywhere we put him, if he wasn't on me or his dad, he would not sleep. So eventually the only way that we could get him to sleep was to tag team sleep with him. So I would get up in the night, I would do 4 hours and sit and watch the TV while he was sleeping, and my husband would have a sleep. And then my husband would set his alarm at 3 o'clock in the morning. He would get up and then swap with me so that I could sleep. It was an absolute nightmare. And then the older he got into, after sort of 6 months, we started having problems with his sort of dietary things. We started realizing that he was excessively crying. He was starting to get little rashes on his body. He was having problems with his bowel motions. He was either constipated or he was we took him down to the doctors, and it turned out he got protein milk allergy, cow's milk protein allergy. So we had to switch him over to special formula. Then he had colic. So all of this sleeping thing was just an absolute horror story for us. It was, and he doesn't have a milk allergy anymore, which is great. He went straight onto cow's milk after he was allowed to go onto cow's milk, and he was absolutely fine with it. And he's 4 now. And I would say it's only in the last maybe year that he's actually slept through the night. It's only been since he was about maybe 3 years and about 2 months, I'd say, that he's actually had a full night's sleep without waking up in the night. So yeah, we've had a hard time with him with his sleep. It's settled now, but it's taken us 4 years. What would you say the most common sleep challenges are that parents face with a newborn and an infant?
Basically, getting them down and settled on their own, I think.
Yeah.
So obviously, as a sleep therapist, when I go out and I do my consulting during the day and see parents, those babies are mostly from 6 months plus, because sleep training you shouldn't do before 6 months, not recommended. So all of my consulting for sleep is for babies from 6 months onwards. And the biggest challenge, I think, is that parents perhaps have had a baby that has had some reflux issues, some kind of underlying medical issue that has not been picked up. And the baby, obviously, if you see the baby in the early weeks, you bring your baby home from hospital, you're told feed, let's get their weight up. They're feeding, trying to put the baby down. The baby has excess wind. It might have some reflux. You put it down too quickly. Not all new parents recognise that the baby has trapped wind. So they might get their baby down too quickly. And then, of course, the baby might settle for, say, 10, 15, 20 minutes and then start to regurgitate. Of course, the baby's never going to settle. You're going to have a baby that's fidgety, fractious, and just will not sleep well. So that, I would say, is probably one of the biggest challenges when it comes to sleep in the early stages, is that trapped wind, incorrect winding techniques. Just some babies do just hold on to their wind a lot more, and it can be quite a lot of vigorous. I've got one at the moment who's just 4 weeks old. And in fact, I actually recommended that they swap her formula almost immediately. I started with her when she was 5 days old, and immediately she looked like a very healthy baby, was a good weight. She was formula fed. And I immediately thought there's just something not right with this baby. She's just not settled. She's screaming in the evenings and was just seeming just not as settled and as contented as she should have been. So I suggested quite quickly that we swap formulas immediately. Within a week, she's bringing up her burps lovely. She's just a lot more settled, much happier baby. We're getting like half the time. It's not a special formula. It's just a different formula brand. But yeah, it's already made a really big difference. Yeah. But I think, do you definitely...
Sorry to interrupt. Do you find that there is a difference between sleep issues with formula-fed babies and breastfed babies? The reason I ask is that obviously, unless you're pumping breast from the breast, you can gauge how much milk they're having. Yeah. Whereas bottle fed, obviously, we knew exactly how many ounces he was having, how often he was having it. But if they're going straight onto the breast and they're just having it that way, do you find that can sometimes cause an issue in terms that mom maybe thinks that they're getting enough milk and maybe they're not sometimes, and that sometimes the reason that they're sleeping is actually they're hungry?
Exactly that. Again, believe it or not, I actually work with more breastfeeding mums than non-breastfeeding mums, which is quite a surprise, because when people would realise the work I do, they automatically assume that the parents I work for must have their babies just formula fed. Actually, no. A bigger percentage of my clients breastfeed. Definitely, I always say when I'm going in with a very newborn baby, some of the babies I'm working with have literally just come home from hospital that day. So if they're exclusively breastfed, I would always explain to the parents that if you want to exclusively breastfeed your baby, I am obviously here to try and give you as much sleep as I can possibly give you, but your baby's needs will always have to come first. So if I haven't got expressed breast milk to offer the baby, or if you're not inclined to give formula, I will have to kind of wake you up. Could be numerous times throughout the night, could be constant. And I always make that clear from day one. That's how it works. Because the smaller the baby, the more frequently the feeds will need to be, of course. But yeah, when I'm working with just a formula-fed baby, I can see exactly how much they're taking. And that's a really good guide. But most importantly, I'm working on the weight of the baby to know just how much they're capable of taking. And obviously in the early weeks of life, their tummies are so tiny. You are feeding frequently and a lot.
Yeah. And I think sometimes it's going back onto the breastfed thing as well, because my son was formula fed. I wanted to try breastfeeding, and I did try, but it was always going to be bottle fed because I wanted my husband to be able to help as well. Oh. And my milk never really came in. But what my point was that I think we take it for granted that it's an easy thing to do to breastfeed. And because my little boy was born in COVID, I didn't have any maternity help or anything like that to sort of encourage the milk to come in. And when I was just left on my own with him, I was thinking my milk hasn't come in, but maybe with a bit of support, it could have. If a nurse had said you need to do this and you need to massage it, it may have come in on its own. So obviously if parents aren't getting that kind of assistance or that advice or guidance, then they may not know, and they may be putting the baby straight on the boob and assuming that it's okay and they've got enough milk and that's it, and it's maybe not.
Yeah, we're all unique and individual, and we produce milk at a different rate. So some mothers, their milk is already in before they've given birth. Other mothers, it can take days for their milk to come through. Yeah, a lot of the time you are faced with a baby that is fussy and discontent. So yeah, every family is unique and different.
Yeah, definitely. And you mentioned sleep training. So can you clarify what sleep training actually is? Because maybe for me anyway, when I hear sleep training, I think of the cry it out method. That's what my head goes to when I hear sleep training, and I balk at that a little bit. I know it works for some people, but for me, it wasn't an option. I didn't really want to do that. So maybe can you explain sleep training and some of the different methods and how parents could maybe decide which one might work for them?
Exactly. And that's really important, actually, that you've mentioned this, because that's something when I go in with a family, the first thing I try to establish is how they want to parent their child. So if I'm going in with a family, and that's one of the first questions I will ask is, I can come up with numerous techniques for sleep training first and foremost, gentle techniques that are much more baby-led and take a lot longer to achieve, but they are achievable. So that's the first important rule, is that we can achieve really good results. But if I leave you with something that you're not comfortable with, you are going to fail at the first hurdle. I don't want to leave this house knowing that you are struggling or finding it stressful. If I left you with a really strict plan, for example, controlled crying, you're not going to feel comfortable in doing that. You're going to be crying with your baby, and that's not right.
Yeah.
First and foremost, I'd like to figure out how old the baby is, how well the baby is doing generally. I would always prefer to give a much more gentle baby-led sleep training technique first, whatever that takes. And there are so many different ways that we can do it. It all depends on what the baby's doing. But again, with sleep training, we're covering everything here. It's not just sleep. It's everything. It's talking about their day-to-day structure, as in not just sleep, but it covers how much they're eating, how much they're drinking. It depends on the age of the child. Once they're walking, it will be a little bit different, but making sure that they're getting enough daylight, sunlight, vitamin D, making sure that their diet is good and healthy and that they're getting good protein. All of these things will come into play when we're talking about sleep. So first and foremost, making sure that the parents are happy with the advice I've given them. If I leave them with a plan that's too strict, as soon as I leave their house, I know that they're going to say, I can't do this. So I make sure that they are confident in moving forwards. And if they wanted, I say to them, I'm not here. So it's down to you how long you want this to take. I'm not going to call you in 3, 4, 5 days' time and say, is your baby sleeping through now? Your baby should be sleeping through. That's not what I'm about. It doesn't matter to me if it takes a week, 2 weeks. It doesn't matter if it takes months. Little steps are better for families that want to do things softly, gently.
Yeah. And you mentioned consistency there and routine. And I was going to say that probably was one of the contributing factors with my son having sleep problems. But because it was lockdown, there wasn't really that many places to go. So I wasn't able to work. My husband was working various hours, but not as regular as he would have been doing. So we would go out, we would go and, get some sunlight by going for a walk, for example. But because none of the baby clubs were open, none of, the parks were shut still when we were allowed to go. So all we had was the ability to walk around the street and it just completely threw our whole day off. And I think for our son, that probably wasn't a great thing because we didn't have a routine. Therefore, he didn't have a routine. And it was like, okay, we know it's bedtime for you now at 6 o'clock or whatever time it was when we used to put him to sleep. But for him, he might have been thinking, I haven't really been outside very much today, or I haven't done anything today. We were obviously doing things in the house with him, but it's not quite the same as being outside as often as we would have been if everywhere was open.
Exactly. Yeah. It's important that they get that stimulation and especially social interaction with other children and families.
Exactly. How can parents help their babies differentiate between day and nighttime? Is there anything that they can do?
Yeah. I think in terms of helping babies to differentiate between day and night is definitely worth getting. Again, I say this loosely because there aren't any hard and fixed rules that you should and shouldn't have. But it's more about helping the baby to understand what's happening next, having a little bit of a sequence of events so that the baby understands what's going to happen next and doing that from a very early age. But in terms of settling baby down for naps, I think it's important that baby understands this is what's happening and we're preparing for sleep now. So obviously having a bit of a wind down before sleep. Again, it really depends on the age of the child. So working with a newborn baby and then working with a toddler is very different. Awake windows are so important for all ages. So making sure that you can understand and recognize your baby's awake window and how much they can cope with before they start to show you the signs of tiredness. Really essential in helping the baby to achieve sleep and to sleep well. But I always say it doesn't have to be like blackout blinds. The darker the room, the better, of course, for sleep. It helps all of us to sleep better if we've got the darker room. But again, in the daytime, doesn't have to be a pitch black room, so long as the room is no bright lights flaring and stuff like that. And I think having a bit of noise in the background normally works better than silence. especially if there are other siblings in the house or pets. I always think a little bit of background noise is better. Babies love to hear voices. So there've been many occasions where I've been out consulting and the mum sort of said to me, oh, my baby just never sleeps, doesn't sleep. Okay, give me the baby. Baby, say 3 months old. I'm standing there with the baby in my arms. We're just talking as we are right now. And the baby just goes to sleep in my arms. I think babies actually prefer to hear that bit of background noise, to hear mummy and daddy and just hear voices. They just seem to sleep better with that. There have been times where I've suggested put the vacuum cleaner on in the background and just hoover around whilst baby's in the cot. Just simple things. A fan, anything like that will work better than silence.
When my little boy was having his naps, we actually made a thing of keeping, not obviously having it blaring, but like you say, we would still carry on with our normal day. So we would have the TV on, we would have friends talking on the phone because we didn't want him to only be able to sleep in complete silence, because that wasn't going to be something that we could continue long term. Because if we needed to pop to the shops with him and he fell asleep and it was his nap time, I need to be able to go to the shops or I need to go out. I didn't want to disturb him. But obviously, if he's only able to sleep in complete and utter silence in a darkened room, it's not sustainable. So we always made a point of keeping a bit of a noise level. And I think that did help.
Definitely. And it's like everything, isn't it? For babies that are just used to sleeping in their cots and in their cots only, because you can always be too strict with it. Yeah. If the baby's only used to sleeping in their cot in the daytimes, what happens when you go on holiday? So flexibility is everything. When I'm working with babies, there will be, although consistency is really important. But once the baby is sleeping well, then you can be much more flexible. So when I'm going into a family and I suggest a plan for them to start to implement themselves with the baby, encouraging better sleep habits, I would always suggest to start with, be really consistent for at least the first 2 to 4 weeks. Be really consistent in your approach in how you get the baby to sleep, so that the baby, first and foremost, understands what's happening and what you're doing. Once that's been achieved, then of course you can be much more flexible in how the baby, where the baby sleeps. Because many times where I'll just cuddle and pat the baby to sleep, or I'll use the pram to rock the baby to sleep. So of course, when you go on holiday, or you're just going out for the day, your baby can sleep in the pushchair or wherever you might be in the sling.
Okay. And what advice would you have for parents that are maybe considering bringing someone like yourself in, a consultant or someone to help them with sleep issues, but are maybe feeling a bit guilty about bringing someone in because they may feel a bit like, I'm their parent, I should be able to put my baby to sleep? They may have that kind of feeling of failing as a parent. And what sort of advice would you have for them?
When I started 21 years ago, when I set up Sleep Baby Sleep in 2005, I used to come across that a lot. Parents feeling guilty about calling me. I'd have a lot of parents calling me in floods of tears. I'd have parents say to me, please don't let anyone know that I've contacted you. I'm pleased to say that over the years, I've seen a big shift in that. It's becoming a lot more normal now for parents to use a sleep consultant, sleep therapist, or just generally get some tips and advice. Again, when parents call me, I say to them, you don't have to take my advice. We can alter it and change it and to a way that it suits you and your family. But absolutely, there shouldn't be any guilt whatsoever in contacting. I think with anything in life, if you're struggling, you ask for help. And that's exactly how it should be. Babies don't come with a journal, and every baby is different and unique. And 21 years down the line of working with literally hundreds and hundreds of families, I'm still finding new things about babies, figuring new ways of doing things. So absolutely, there should not be any guilt attached to it at all.
Definitely. And that's exactly why Stages for Ages was set up, to give parents that, I suppose, a village of support, essentially, where they can access this kind of information as a sort of an all-in-one platform to be able to get all of the information that they might need in one place. And obviously having experts like yourself coming in and helping is amazing, and we really appreciate that. One of the key kind of questions that I wanted to ask, because it's one of the more serious sides of sleeping, would be the guidance around safe and comfortable sleep for babies, because I know it varies country to country and it sometimes changes depending on laws and regulations. So what are the key kind of components at the moment for a safe and comfortable sleep environment for babies? Where should they be sleeping and what in?
Really good question. Absolutely. Ideally, their own cot, crib, or Moses basket. The baby should not be too hot, should never wear hats. Feet to foot position, really important. But basically, yeah, can go on and on about smoking, non-smoking, stuff like that, but I won't. But yes, basic, to keep it really simple, feet to foot position in their own crib, Moses basket, or cot is the safest way for a baby to sleep. Nothing in the cot, nothing at all, no teddies, no extra blankets, no muslins, no toys, an empty cot with a firm, flat mattress.
Lovely. And just from your point of view, and I know this was one thing that I struggled to understand, but for the people that are listening, can you just clarify the position on cot bumpers, why they are not recommended for people to have in cots?
Absolutely, yeah. Cot bumpers are absolutely not recommended at all. They're not recommended for safe sleep. I know people do like to use them because they think they're pretty and they make the nursery look lovely, but absolutely they are not recommended. There shouldn't be anything surrounding the cot, nothing in baby's way at all. I know people will say, oh, a newborn baby's not going to roll or move or anything like that. But again, air quality is really important when a baby's sleeping. Of course, babies do move around very quickly, a lot of the time without us even realising it. They could move, they can get caught up in them. An empty cot is the safest cot and the safest way for sleep. So no cot bumpers.
Okay, fantastic. And then just to finish on, is there, just to go through a couple of kind of common sort of issues that I've seen people mentioning, how can parents deal with sleep disruptions like teething, for example, or the many sleep progressions that children go through? How can they deal with those if they've got them in a routine and then something disturbs that routine that they've already got?
Of course. And it doesn't matter how good the routine is that the baby is in, there will be times throughout the baby's life that will change and that will alter. And routines, I can set a routine up for a family with a young baby. Within 6 months, that routine will change and alter, but only very slightly. But yeah, I think it's important to remember when the baby's unwell. So with teething, like you say, obviously the right medication for the baby is the first thing that I will be suggesting. Ibuprofen, if the baby's over 6 months, it's really good for inflammation of the gums. So that's what I would recommend. Calpol, all of the usual things for teething babies. If you prefer like a more natural route, then obviously your powders, your Ashton Parsons powders, your cold flannels, things like that on the baby's gums, been really helpful. But of course, there are still going to be times if the baby's unwell, got fever or something like that, then I would always say, if we're going through a sleep training program, you have to stop. Really unfortunate, but even if we're 3 days into the sleep training program and the baby is unwell, stop the program, focus on the baby, do what you have got to do to get through this difficult time. Doesn't matter what you do. Even if you have to resort back to cuddling the baby for every single sleep, that's what you've got. As a parent, that's what you've got to do. So don't beat yourself up about it. Don't feel like you failed or you've regressed. You can always get baby back on track. Yeah, just relax, basically. Relax and enjoy your baby. Enjoy the cuddles.
Yeah, definitely. Thank you. Okay, fantastic. I'm going to ask one more question, I think, before you go. What's the best piece of sleep advice that you've ever received or given to someone that worked really well?
I think the best piece of sleep advice would be to just, first and foremost, enjoy your baby. They're little for such a short time. Don't get stressed. As you can imagine, I see parents on a daily, weekly basis that are stressed and not enjoying their baby, struggling to bond with their babies at times because of the lack of sleep. And this phase is not going to be forever. Relax, enjoy your baby. Don't beat yourself up if you have to cuddle your baby to sleep. You're not failing. Yeah, I think In terms of actual achieving good quality sleep from your baby, it is about understanding cues from your baby. Observe them, recognize their sleepy signs, and then act on that. There's no point you trying to get a baby that's perhaps wired or overstimulated, overtired to sleep, because that is a real battle in itself. You're better off letting them go through all of that, getting all of that adrenaline out of them, and then starting again half an hour from 10 minutes later. Some parents will, if they think their baby's tired, they will just try to get their baby to sleep and continue to keep trying and trying and trying. I'm like, enough's enough. But you have to reach a point where you go, look, I'm only going to try this for a set amount of time I feel comfortable with. And if the baby's getting upset and you're getting upset, stop. Do something completely different, diffuse the whole situation, go out for a walk, get a bit of fresh air, just do something completely different and then retry. Your baby will sleep eventually.
Yeah. Lovely. Thank you so much, Tina. So how can parents get in touch with you or learn more about Sleep Baby Sleep's services and what you do?
Yeah, you can Google my name, Tina Southwood, as I've been in business for quite a lot of years now. Google recognises me pretty well. And you should my website link there. That's www.tina@sleepbabysleep.co.uk. You can find me on Facebook as well under Sleep Baby Sleep, and I'm also on Instagram, Sleep Baby Sleep.
Fantastic. And I will put all of Tina's links and information in the show notes for anyone that's reading the show notes. They'll be in there as well. So thank you so much, Tina, for coming on. Really appreciate your time and the information that you've given. I think it's going to be invaluable. I think sleeping is one of those problems I think all parents actually have, but probably it's one of those ones that we all seem to struggle with. It's nice to have someone that knows a little bit more about it and just be able to give some advice about it. So thank you very much for coming on. We really appreciate it.
Thank you very much.
Lovely. And maybe we can have you back on again on another time and have another chat with you about some other questions that people are asking. And yeah, it's lovely to have you back on.
I'd love that. Thanks ever so much. Take care.
Lovely, Tina. Thank you.
Bye.
Don't forget that you can come and join the Stages for Ages parenting support group on our website, where we have got access to other experts, including Tina, who will be available to answer your questions. And we also have courses that are available for anyone that needs some more advice. Thank you for listening. See you next time.